Well, we've got a very nice audience all waiting to hear from you. And so, welcome. How are you doing?
Thank you, Roy. I'm doing really well. Yeah, whenever you ask me this, because I know you actually care about the answer, I kind of toggle between saying fine to actually sharing how I'm feeling. It's a mix. There's a lot, I think from what's happening for all of us in the country to what's happening for our staff, especially those who provide direct patient care. And then, and then this discussion, which I think is the hopeful part of my day, because we're talking about innovation, we're talking about no going back, and some of the silver linings that we can capture that the Academy of Fab Stuff has been working on capturing for so many years. I think it's important, more than ever.
Yeah, well, thank you for that. I mean, we do try and live in the world of the pursuit of excellence, and we believe you can only do that by sharing your good stuff. I mean, it's asking how people feel and listening to the answer is very important. I mean, I was talking to Jeremy Hunt the other evening, and he said, "How are you, Roy?" And I said, "You know what? The answer really is I'm frightened. I'm in my mid-70s. I've managed to survive the first wave of COVID." And it looks like we're going to have to go through it all again. I moved from Surrey up to my flat in London, which is where I am now, and we know that it's all kicking off again in London. And I feel frightened about what the future is going to hold for me. And I don't know. There's nothing I can do about it. I mean, I've led a life of looking after myself and being fairly robust, but here I am now with a set of circumstances that I can only be in charge of for a limited part of it, and if I don't feel in charge, I don't feel secure. Does that make me crazy?
Not at all. I think feeling powerless is one of the most difficult feelings we can have. So no matter what the difficulty is, if we feel we have choices, if we feel we can do something about it, that's, I think, we still feel sort of that we have agency, but it's when we don't have some of those choices and feel powerless that I think it's, it leads to depression, it leads to anxiety, so I completely understand, and we all are feeling elements of it along with you, Roy.
Yeah, good. As long as everybody's in the same boat, I don't feel so bad. Listen, anyway, that's it. I feel so much better for getting that off my chest. Thank you very much. It's lunchtime therapy with the people person. Listen, talking to people person, where are we on the people plan? What's happening?
Yes, that's a great question, and I would love to talk about it for hours. So let me start by saying that, one of the questions I'm asked is, why did you publish during a pandemic? And actually, the answer is very much linked to the Academy of Fab Stuff, because we published so that we don't go back. We published so that one of the key outcomes we've seen in the first few months of the pandemic, which is the focus on NHS staff, the focus on our people, we don't want that to be rolled back, whether that's the local support that was given to staff, it's rest spaces, or it's the tea and coffee, or it's the food, or the reduction in bureaucracy, the returners coming back. We don't want any of that to be rolled back. And so we wanted to capture that in a document, even though, there are more changes that we want to study because it's still ongoing, but the early changes we've captured in a document and published it. So that's the reason we published, even though it's a pandemic, and it has lots of examples that we've taken from the Academy of Fab Stuff, because one of the things we want to do is share that everything in the people plan is happening somewhere in the NHS. Just not every day and not everywhere. So that was published.
Just stop you there. That's a really nice phrase, isn't it? It's like the Morecambe and Wise thing, isn't it? I'm playing. What is it? I'm playing all the right notes, but not necessarily in the right order. We've got the people plan being played somewhere, everywhere, but not necessarily all of us together. And I guess I like that, because that makes us think, what do we got to do to get in step, I suppose.
Absolutely. So I think that is exactly what the connection of this your conference, and I just seen the agenda. It's got some brilliant sessions. Is about how can we make sure that every one of our 1.3 million colleagues is experiencing the best of the NHS, because there are such incredible things happening. So we published it with across 350 stakeholders, tens of thousands of staff, and since then, for the first time ever, in the formal planning guidance to all employers and systems, there was a request to share people plans from each system. And with and every employer. So for the first time, people took the 4 elements, which are taking care of our staff, belonging, which is about equality, diversity, and inclusion. The third is working differently, which is exactly what this day is about. And the fourth is expanding our workforce. So every system has taken these 4 elements with the actions that are in the document and have adapted it to what it means for that system. So taking into account local conditions, local labor markets, demographics, etc., and the services that they provide, they've created a work plan for the people plan implementation. So we have 44 of those. We've analyzed them. My team and I have gone through each one, seen where people are finding it easier and where things are feeling more difficult. And actually, so the 2 areas that people need more support on, it won't surprise you. One of them is equality, diversity, and inclusion. So there's a real focus on it and there's a will, but people are not always sure about how to go forward on it. So it would be great if the Academy of Fab staff also had a focus in the coming months on, so where are the brilliant actions and interventions on equality, diversity, and inclusion. And I actually, if I may, I wanted to share one because it's just so brilliant in its simplicity and it's powerful, which is that one of the trusts, an acute trust, has installed 10 of those machines where you give feedback at Heathrow after security, with the smiley faces. They've installed those. They've changed the labeling to say, I have experienced kind of racist abuse today or harassment or something. They've changed the labels. They've put them into 10 spots in the trust based on the insight that people want to share their negative experience if they've had one, but then they don't want to get into the very distressing sort of reliving of that, and therefore it's underreported. So what they've done is they have found people are using those feedback mechanisms, and with the data, they've found maybe it's 3 a.m. in the emergency department where actually more managerial support is required. Or it's a Friday afternoon in one of the understaffed units. So it's given them a lot of insight into where people need to intervene. And that, for me, is such a brilliant example of converting intention about equality, diversity, and inclusion and reducing bullying and harassment into some tangible actions. So I would say...
Let me just show you. This is my iPhone. You can see there's an icon here. Mm-hmm. That's the Academy's Fabometer, and we do just that. We say to people, "How was it for you today?" And that gives the trust a dashboard to see how the morale is measuring up in different parts of the trust. So
that's brilliant. I would love for that Fabometer to be on everybody's phone across the 1.3 million people, so that we can then, managers, leaders, and teams can take action on an ongoing basis, as many do. So systems have found that to be an area that they would want more support on, which is the people plan pillar of equality, diversity, and inclusion. What they're giving a lot more focus on the positive side, what they're giving a lot more focus in concrete plans is the focus on health and well-being of staff. So, just doing a lot of insightful things on whether it's how teams do leaving well checklists, how they have good supervision, how they can have a rest space. They have made a trust that had absolutely no space for a rest space has made a virtual wobble room, and a trust has made a wobble book so that people can actually share online and say, okay, actually I'm struggling with this, can my team help? So it's just that health and well-being focus is from the people plan and actually from COVID. We just captured it.
The wobble rooms are really interesting because they first came, they appeared on the Academy of Fabulous Staff. They just went whoosh like a bushfire through the NHS, and we had the originators of the wobble rooms giving us a presentation this morning, and there were several hundred people that were watching that this morning. They really have hit the spot, Pranay. It's really people really have appreciated them.
Yeah, absolutely. Yeah. So that's the kind of glass.
If I may, so I'm sorry to interrupt you. Slightly delay on the line, which is slightly awkward. Look, we've only got a couple of minutes left. I think the big issue that I get asked about all the time is we're having more and more people now inquiring about a career in the NHS. We've got over 200% increase in people hitting the button in NHS careers. Are we going to capture those willing people and bring them into the system?
Absolutely, and it is a very, very important question because exactly to your point is that our recruitment processes are not always geared to being sort of friction-free, as it were, and ensuring that we are ready for the kind of interest we've seen. So part of what systems have come back with is their recruitment plans, especially for entry-level positions, for apprenticeships, for non-clinical roles, because we have lots of vacancies there as well. So there's that sort of immediate action to capture this interest. And then, of course, there's the longer-term education and training placements. As we've seen, 22% increase in UCAS placements of nursing degrees. 22% is the highest, I think, in 30 years. So and that's one type of capturing the interest, which is straight into education and training. And then the other is at the system and employer level. And in some cases, I think employers will need to, or systems will need to think differently about the scale in terms of recruitment, because what was earlier a few, you recruit a few people a month, is now needs to be a much bigger sort of batch recruitment effort. And that's what we are supporting systems with.
I think that's great news. Well, we're up against the buffers of time, so forgive me. I know that we've only got a brief time with you, and I'm sorry we couldn't see you in vision.
I'm sorry.
The technical guy working behind it, he said that you needed to turn your camera on, but I'm not sure that's I'm not sure that's right. Anyway, listen, bless you for finding the time to talk to us. Thank you so much. Miss People Plan. Thank you.
Thank you, Roy. Thanks to you.
From the people, thank you.
Oh, that's very. Oh, I just folded my hands too, even though you can't see me. So I wanted to say thanks to you and the team behind this wonderful event, because it gives hope and energy, and that's what we need at this time. So thanks very much, and stay well and stay safe.
Thank you. It's very kind of you to say so. Thank you. Keep well. Keep well.
Thank you. Bye.
Bye-bye.